how did you decide to be an orthodontist? Let's start there. Why orthodontics?
Yeah. Well, even dentistry, it was brand new to me. I didn't have any family members or people that I looked up to that were dentists. I was fortunate. I didn't really have many cavities growing up. So I just went in for my routine cleanings and really didn't have a good impression of a dentist. It was like, oh, it's fine, but really didn't know much of it. I did have orthodontia when I was, I think, 12 or 13. I have to show you my before and after photos, but I actually had a 4x extraction for my own treatment. And to this day, it's shocking. I looked at my before photos. I barely had any crowding. I was a little overweight when I was younger. So obviously I had, what's the word? A bit more, soft tissue on my lips. And I think the orthodontist wanted to help with that, with my profile. But I still remember my mom gave him a hard time about, why did you have to get teeth taken out? Why are you, he doesn't have any crowding, what's the issue here? And she kind of gave him a hard time about it, to the point where he kind of got fed up, turned his back on her and said, you know what, if you don't want to do it, then you can leave. And I think she thought about it for a while and then ultimately ended up going with him. But I was the worst patient. I never brushed my teeth. I never wore my rubber bands, and kind of embarrassing to admit that. And today, and that's why I feel like I can relate to a lot of the patients that I have now, and the mindset of a 12-year-old. This is the last thing that they think about. Their dental hygiene. They just care about what video game am I going to play that night. But fast forward to undergrad, I was a bio major and was a pre-health. I wanted to do something in the health professional space. And I was kind of meandering about. I had a couple cousins that were in pharmacy school. And so I thought about that for a while. But something that kind of stuck with me was my early formative years in high school around 2007, 2008 was around the time of the recession, and I still remember my parents kind of having a difficult time with that, and my dad was working for a company and ended up leaving that company for whatever reason, and I was like, I don't ever want to be in a situation where that can happen to me. I wanted to kind of be my own boss, pave the way for my own future, and so ultimately, I landed on dentistry. It's one of the last professions in the health professional field that you can have your own business, you can see your own patients, make your own schedule. And that just resonated really well with me. And, I haven't looked back since. And
then dentistry, but why ortho?
Yeah. So that was just more fortuitous. I went to UCLA for dental school, and the mindset of all those people there, they're just very, very driven, very type A personalities. And so I kind of went along with that, and everyone had the mindset of, if you're not doing a residency program, if you're not doing training afterwards, there must be something wrong with you. So our specialty, or the number of students that go into specialty programs there, I think it's upwards of like 70% of whatever different specialties. And so that kind of opened my eyes to what the different options were. And then my mentor at the time was interested in going into ortho school, and he was like, yeah, it's great. You have a great work-life balance. You can see a great demographic of patients. People aren't in pain. People aren't, seeing you because they have to, but it's because they want to. They want to have a beautiful smile. And it's also a bit more laid back. You see primarily teens, and they're not going to give you a hard time. So all those things, I was like, yeah, that sounds great. It was kind of between that and oral surgery, like a lot of people. But I just couldn't see myself standing for 7 hours doing a surgery. So that wasn't for me. But yeah, the shadowing during dental school and seeing the lifestyle of orthodontists, that just made sense, and I wanted to do that.
It's interesting because you said that your mentor pitched you on the lifestyle and the low-key nature of ortho, and then you come into a place is basically a medical profession and is all about people, begging for relief from life-threatening conditions. That's amazing.
Yeah.
Okay, so where'd you go to ortho school?
I went to the University of Pacific. So
that's right.
UOP. That's right. Yeah, it's up in San Francisco. And I was so fortunate to have gone there. And this is actually a funny story that I don't think I've shared with you yet. I started my ortho school, my ortho training in 2018, and it was that year that they developed a relationship with Stanford Sleep Surgery Center, and Dr. Audrey Yoon became a clinical faculty member there. We had the chance to shadow rotate through Stanford, and I got to see some of the sleep surgeries going on there, and that was really what opened my eyes initially to the possibilities with orthodontics. A couple months ago, I had the opportunity to see my chair of that department, and she shared with me that it was because of Bill Hang lecturing over at UOP at an alumni event. I think it was back in 2014 or 2015, and him sharing in his way how orthodontics that was being done was adversely affecting the health of all those patients, and saying how 4-by extractions are, to put it bluntly, are killing people. Right. And so a lot of alumni obviously weren't too happy about that, and so that made the administrators take a second look about, what is this Airway thing? Why is this guy making all these claims? And so that was their kind of response of learning more about it in the academic sense. And so that's why they developed that relationship. And I think, I mean, had he not done that, I probably wouldn't have been as involved in the Airway stuff as I am now.
It's funny that, because I think I've told you this story. I've told a lot of people the story. When I first met Bill, I was in my late 20s. Outside of Killington, Vermont. I was a ski bum. We had a video production company, mm-hmm. and he had made an appointment, and he and Debbie walked up the stairs. And as I remember it, and as you say, in Bill's way, sticks out his hand. Hi, I'm Bill Hang. I'm an orthodontist. We're moving to California. Let me ask you a question. Did you have 4 teeth pulled when you were a teenager? And he had less of a filter then than he does now. And I have told the story so many times, like, my life pivoted as a result of that one conversation. That's just one life. And then the ripple effect just from my experience. Yeah. And all the time I've worked in Airway. That was 25 years ago. Oh, and then all the lectures that he's given. Yeah. And I don't know that a less intense personality could have done it. It was everywhere we went in those first 10 or 12 years. Right. Nobody wanted to hear what he had to say. He would put up hundreds of cases, and they would look right at him and say, it's not true. And I'd be like, I think you guys might be shooting the messenger. I mean, I'm not a doctor, but I'm looking at this, and it doesn't look good at all. And then I started interviewing the patients. Yep. And they were saying, I can't sleep at night. I can't breathe. My blood pressure is through the roof. Right. And I'm like, I think this guy's right. Anyway. Okay. So you get out of Union Pacific, and what I want to get to is how do you get a deeper and deeper commitment to an Airway focused ortho practice that's going to set you off on a career at the leading edge of an industry? I know you well enough to know that there's a lot of inner fortitude in there. You don't impress me as the aggressive trailblazer Bill Hang type. Am I right about that?
Yeah, I mean, that's certainly not my personality.
It's not,
but
you're doing it. You're doing it.
Yeah, I've always been more of the quiet kind of introvert, and a little bit more of the pensive type to really figure out for myself what makes the most sense, right? And something that Bill kind of said that resonated with me was, the main reason he got into this was because he listened to his patients, right? And at the end of the day, I think that's what we have to ground ourselves with is are we doing right by the patients? And does it make sense what we're doing, right? And when a patient says, hey, what you're doing is causing adverse harm, it's, I can't breathe, or all of these conversations I've had in consultations and from people across the country, across the world that have the same message. I've had teeth taken out, and now I'm having breathing issues. It's story after story. It's so compelling. I mean, before I joined this practice, I didn't hear that, right? And obviously just by a product of me being in this practice and a lot of patients kind of gravitating toward all the content that Bill has on the internet and on the website, and how he's educated everyone. I think that message is getting out there, and you're absolutely right. He's touched the lives directly of so many patients that he's treated, but also indirectly through seminars, lectures he gives, all the content online, and thanks to you that's been disseminated, so widely across the world.
Yeah,
and
it's
that's
amazing.
Incredible.
It's amazing. So You got a taste of Airway before you went to work for Bill when you were down with Catherine.
Yeah. Yeah.
So did you work in a traditional ortho practice before that?
I worked in conjunction while I was there as well. So I was working in two offices, hers, which is the Airway TMJ orthodontic office. And then I was also in a corporate kind of DSO office. And seeing the disparity between the two is definitely, something that is an interesting dynamic, right? So I was able to get a taste of that world, seeing 40, 50, 60 patients a day, kind of running a mill, if you will. I've always had the principles of trying to expand whenever possible, having early treatment, early expansion. But a lot of the resources, a lot of the treatment options, modalities that you'd want to have at your disposal, you can't do in a setting like that. Which is why I understand that a lot of orthodontic offices are not equipped to provide this airway centered modality, this airway health treatment. It requires so much more time, so much more effort in that diagnosis and that planning process, right? And the current model of orthodontics, it's very difficult to do that.
Interesting. All right, I want to take this next one in two parts. So, if we take a look at the pioneers that got us here, Hang, Hinden, I would say Gelb has been a big part of it. Barry Raphael in the last 10 or 15 years, what Mark Cruz has done now. Ben Maraglia is picking up the baton a little bit. Lauren Gates is doing a lot of work. Airway Circle, what Renat is doing. Mm-hmm. It just keeps going and going and going. So there's a generation of you that are 10, 15 years out of school that are picking up the baton and moving forward. So it's a two-part question. What do you see as the evolution of the practice here in Agoura Hills? How does that change and evolve so that patient health gets better? And then, and we'll take it in two parts, where do you see your generation taking orthodontics? Because we still have a long way to go. I've said no to 3 orthodontists in the last few months because they are still extracting bicuspids when they don't need to. So it's still out. It's not what it was, but it's still out there. We still have a long way to go. So where do you see your generation making a difference in the practice every day? Mm-hmm. And then where do you see your generation making a difference on the profession?
Yeah, I mean, I think what my generation and probably more so the next generation, the Gen Z is really good at is voicing their thoughts, their opinions, and all of that, and putting out for the world to see. Right? We have tools now that we can share all the information that we want to a much broader audience than we ever had before. And I think we're going to leverage that and use that to our advantage. Right? I think most of the people that we see in our practice find us online, which is very unusual. Compared to 10, 15, 20 years ago, where it was your local general practitioner, your general doctor that referred you to the office. Now it's completely flipped on its head, and people are searching for who's the best, right? We when we think about what restaurant we're going to eat, the automatic reaction is we pull out our phone and we Yelp it, or we Google it and see, where do I want to eat tonight, right? And that's what's happening with everything that we do, with whatever product that we're looking for, whatever service that we're looking for. And I think that that message of hey, what we're doing is superior, or it's a different approach, and here are the benefits and here's why. I think intuitively it makes sense to parents and to the patients that are receiving that treatment. That's why they're choosing this, right? Even though it may be more time consuming, it may be more resource intensive, both time and money and all of that, and they still choose to go with it because it's they feel it's better for their health, and oftentimes it's up to us to show them that, because obviously the research lags behind clinical practice, but we have so many patients that tell us, hey, what you did, it helped me, right? And we have to listen to them.
So what do you want? It's interesting that you answered that question from a communications perspective. That's a very interesting answer. What do you want families to know when they walk in the door up there about not just you, but about your generation of orthodontics who sees the benefits of an airway focused approach?
Yeah, I think, there is no one cookie cutter right thing for everyone, right? I think you need to find a provider, whether it's your dentist, your ENT, your orthodontist, who has discretion. They're not using a one size fits all approach. They have the right tools at their toolkit. They have. I think it's tough because. The term airway dentist, airway practitioner, I think it has become more commonplace, and it's overused, and it's hard to differentiate. What does that mean, right? And I think, unfortunately, a lot of that burden comes to the patients and them having to educate themselves on what the difference is between what one treatment plan would do versus the other. And obviously, we're here as a resource as well for those patients who might see other orthodontists or might see other other providers that might suggest something, and we'll say we might not do it that way, and here's why. And you have to be as open and honest with them as possible. It's
an interesting question. What is an airway practitioner? What, in the best of all worlds, if somebody says, what is Tim Yu, the airway practitioner? What does that mean? Or in the best world, what would you like it to mean?
Yeah, I think someone who has a fundamental understanding that our airway health is integral to our overall health and well-being, and what we do as providers of orthodontia or of dentistry or whatever it may be has an impact in that, and we have to respect that and take that into account during our planning process, during our treatment process, and that has to be one of the goals that we have at not necessarily. Treating that directly, but at least respecting various things that can contribute to an improved airway, and not kind of working in the opposite direction of not retracting, not making things smaller. That's from my personal perspective in orthodontics, but that can apply broadly to whatever discipline you're part of.
Sure. Where do you stand on collaboration inside and outside of dentistry? I know that you talked about your generation being much more open to sort of transparent communication with the masses. It seems like there are less barriers, even if they're internal barriers, to reach outside of your profession to find ideas and ways that you might be able to help a patient that aren't just inside of the discipline of orthodontics.
Yeah, that's a loaded question. So, I mean, from working with Catherine and Stanford has a wonderful kind of interdisciplinary care model. I absolutely see the value in that. That has to be part of the future. That has to be part of the equation. Otherwise, all of our healthcare is so fragmented. We're not sharing notes with other providers. We're not understanding what our patients do at each of these different places, and there's so much that can be gained from being able to have a more collaborative environment. And I think that's what APMD and what you're doing matters so much, is that we have to bring these providers and we have to speak the same language and look at the same things and diagnose the same way. And obviously with Dr. Zaghi as well, having integrative kind of model and I think that just, it benefits the patient so much.
What, in the best of all worlds, what kind of a collaborative team would you have around you? What disciplines would be sharing patient care with you?
So certainly a myofunctional therapist is one of our kind of bread and butter go-to referrals. I mean, if you don't have proper function, you're not having a solid foundation of what you're building a house, and so that's a huge part of the picture. You have to have the ability to breathe well, right? And so looking at all the factors that would compromise that, right? So an ENT specialist is a big part of the picture, or an allergist if they have allergies, a breathing specialist, right? Helping them to nasal breathe or diaphragmatic breathing. All those are important parts. And then having a sleep physician who's well versed and knows what other modalities of treatment are besides kind of the go-to conventional treatments like CPAP and oral appliances. Understanding that there are other things that can be beneficial. A big topic that doesn't get as much attention, unfortunately, is nutrition, right? I don't know if you have noticed, but we have a huge epidemic of obesity in this country, and you know, our nutrition is so lacking that I think that's a major cause of a lot of these chronic diseases that we have, including the airway diseases, right? And so, you know, there's so many factors that contribute to having overall health and well-being, and that's why it's so complicated. We try and put all of the onus on this one provider to fix all these problems, but there's so many different elements of it, and it has to be done with everyone working on the same team for that patient.
Where do you see the face focused practice? You know, what's the pivot going to be under your stewardship as opposed to where Bill took it? No pressure.
6 months in, yeah, I'm still figuring it out, Peter. I gotta say, I mean, I admire him for what he's built, you know, and I mean, I don't know if I could have ever done that. I mean, there's so many. I'm just so non-confrontational, and I mean, probably the moment I've you know gotten pushed back, had my back turned from the profession and you know, completely sidelined. I you know, he's walked a very lonely road for a very long time, and to do that with still the passion that you know he has today is incredible. You know, having said that, I think what we just talked about, trying to prioritize that interdisciplinary care, I think is crucial. Building the right team around us, and that's very important. And then really, I think the new frontier is how do we use all the digital technology at our disposal. You know, there's so many technologies that are coming to the forefront that is only going to enhance and improve what we can first see, so diagnose with the diagnosis, and then with the treatment, and so you know, incorporating digital technologies and all of that is you know, already kind of being done generally across orthodontics with, you know, aligners and things like that, but with various appliances too, you can kind of basically custom make, right? You can custom fabricate appliances specifically for a person, with kind of the metal printing that's done. I'm very excited about that technology. I had a chance to speak with Reza and you know, all of the surgeries that can be done to such a finer precision now because of that digital planning. It just kind of changes the rules of the game, and how you know, surgery 20 years ago, you know, people still ask me, hey, do I have to get my jaws wired shut? I'm like, no, you don't. We don't wire jaw shut anymore. We don't need to. The plates are so strong. You know, we may have to use some rubber bands, some elastics for a few weeks, but yeah, it's just a different game.
I'm glad you wound around to that, because I know you're a technology enthusiast, and yeah. and if someone asked me that question, a little bit I know about you so far, you know, where's Tim going to make his mark? I probably would have leaned into, in the early days anyways, technology. And I think around diagnostics, isn't that where you're putting together a protocol that's pretty unique?
Yeah, absolutely. So I think first it starts with the diagnosis. You have to get that right. So understanding the jaw relationships, where they are now compared to where they should be. And then, you know, I always have to take a baseline assessment of their symptoms, right? Because, you know, what you may think, you know, you see a patient, you may think that they have a certain thing. And, you know, just to this day, I get shocked. You know, I see someone with a completely retrognathic upper and lower jaw, and they're like, no, I function fine. Their sleep studies are normal. And they just, you know, by whatever miracle, you know, that happens. That's why it's so important to get that baseline understanding of every person as an individual. Just because they fit into a box, they might not, you know, you can't treat them just like everyone else that might look like them.
What's your counsel to dentists and orthodontists coming up through the educational ranks as the consolidation kind of gets maybe a little bit more intense, with the DSOs kind of taking over more and more, and the opportunities to go into private practice, maybe that's a little bit of a longer road, and the compensation maybe isn't quite what it would be if they took the corporate path and they pitched the work-life balance. What would you say to somebody coming up that has that desire to make a mark?
I mean, I'm a little biased here, Peter, because I mean, I
That's
fundamentally,
why I
not a little bit. I'm very biased. I mean, I fundamentally believe that Airway Health Centered orthodontics is going to be the future of orthodontics. I mean, when I was going through residency, there was so much fear around these at-home aligner companies like Smile Direct or whatever, and I felt like whatever, they can do their thing, and they're actually one of the best marketing companies for us, right? Because everyone has just a collective now mindset around, hey, my teeth are a little bit crowded. I need to straighten them, right? And maybe some of them may go there, but by and large, at least most of them will understand that there is value to going to a health professional. But having said that, I think what we provide as the Airway Health Centered orthodontists is that next tier, right? We can't be replaced by a company like these at-home aligner companies. It's just completely off the radar, right? What we do is so unique. We get to be a doctor again, and that's just so powerful. That's what we went to school for, to help our patients. And so I think that part of it is the most fulfilling part for me. It's not just making someone's teeth straight. It's not just giving someone a beautiful smile, but hey, in that same process, I can help you breathe better and sleep better, in all the benefits it has to other parts of your life. That to me is, that's the most rewarding part.
It's interesting you say that, because what I'm seeing with my clients, anecdotally, I don't have data on it yet, is that what you just said, Smile Direct is actually making the dentists and orthodontists who see themselves as true healthcare providers that understand physiology, that understand physics, that understand for every action there's an equal opposite reaction, that understand that every time a body part moves, it affects every single other body part, especially musculoskeletally, I believe,
It's
if
a
I
tough
said
word.
that right.
Yeah.
That I see two things happening with the at-home aligners, and casting no dispersions toward them. I think that there's a place for them,
Right.
but there's underdiagnosed cases because they don't take a CBCT. They don't have a full panel on everybody. They don't necessarily see the jaw relationships. They don't see movement relationships. They don't see airway size before they make decisions. So there are some aligner cases that unknowingly are going to exacerbate problems that maybe were just under the surface.
Absolutely.
Which are going to find their way into your office.
Absolutely.
And I'm seeing that around the country now. And the other thing is, if we don't have that accountability of somebody that we admire and respect to help us get through the treatment, we're going to give up on the treatment. And I've started to see that anecdotally around the country too. So I tend to be a bit of an evangelist to all my docs that call me on the marketing side. Is, I'm going to help you with communication, but what you really need to do is step into the opportunity of a lifetime that you're in right now.
Right.
There's so many people without your training, without your understanding, without your passion, without your soul, who are treating with limited amounts of information. And that's creating a tremendous opportunity for people like you whose motives are right, who have dotted the I's and crossed the T's, and who really understand the overall human body. And it's going to make for a whole industry that's going to be absolutely unstoppable. There's some tragedy in that, because what I'd like to see is to put all of you out of business. And I don't know an orthodontist, when I say, okay, let's set aside the relative unkindness of me saying that, right? I don't want you to starve. But wouldn't it be nice if we went back to a time where we didn't need orthodontists, which 300-400 years ago, there was no need, because
Absolutely.
there were no malocclusions. There was not tooth decay. So I just talked a lot. Bounce off of that.
Oh man. I mean, that's very optimistic of you, but I don't see our overall diet, culturally going to change anytime soon. I don't see our obesity rates changing anytime soon. Right. I think, if you look at, cross-culturally and across generations of what are some of the etiologies, what are some of the causes of malocclusion, of poor breathing, poor health. A lot of it stems from diet and lack of exercise as well. But certainly our diet is a big contributor to that. And, a lot of the myofunctional therapy classes I've taken and understanding that how that has such a big predictor on the first 6 months or year of our life has a big predictor.
Tongue ties.
Yeah.
There's before Zarouche and after Zarouche. And have there always been this many tongue ties? Are we over diagnosing tongue ties? Is it new? How did that become such a big issue?
I mean, that's where the current mindset is now. I mean, it's like if you're looking for something, you're going to find it. So my belief is that I don't think there's, drastically more tongue ties now than there were 10 years ago. I mean, I have a personal story, actually. My sister just gave birth about 6 months ago. And a cute little baby named Peter as well. But this kid has the biggest tongue tie that I've ever seen. And, he's lucky he has an uncle who's an orthodontist that's able to evaluate that, because not one of the many providers that went, that she went to early in his care, be it the pediatrician or the, what do they call it? The one who delivers the baby. Gosh, I can't think of it. OB-GYN, or the feeding specialist. No one really saw that the tongue tie is an issue. And so I think, yes, in the airway community, we see it so much more, that we see the messaging that has taken a hold, and how it's just so kind of saturated in everyone's consciousness. But at the same time, how much of the broader conversation in the everyday hospitals is it happening, and should it be happening more? I think that's a difficult question. Yes, I see the relationship of having a tongue tie and impaired function, but I think we don't really understand the true relationship between how that affects every single person on an individual basis. I've personally seen people with tongue ties and nice broad arches, and so it's not a one-to-one correlation. But I think of everything as risk factors. If you have kind of 10 things stacked up against you in this column, more likely than not, then you're going to see some detriment to function, to things. And so what I tell my patients is we want to lower those risk factors. We want to reduce those risk factors as much as we can, and get your function working, so that can not be part of the equation that you have to worry about.
What are your biggest challenges day to day in continuing the momentum in an airway focused orthodontic practice?
Day-to-day challenges. I think the broader dental community, kind of educating them on why what we're doing is different, why it's important. I think there is this understanding that, hey, if the teeth fit together, if they look really nice, that must be the healthiest thing. And certainly, that's why teeth are taken out, right? So the teeth can fit better, and so it looks pretty. But is that the best point of health? And I think challenging that norm is a challenge, right? I mean, that's kind of the dogma that you're taught in orthodontic residency is what are the keys to occlusion? What are the factors that make our occlusion, our bite, the most stable over time, the most healthy, and so coming to this practice, I've had to unlearn a lot of things before I've had the opportunity to learn what is it actually that we should be doing.
Well, and then the follow-up to that is what are the biggest opportunities that you see? And I have thoughts on both of these that I want to share from a different perspective.
Okay,
but I want to hear yours first.
The biggest opportunities. Well, first, let me say we're very fortunate at Face Focus, where a lot of the patients kind of self-select and find us because they're looking for an airway provider, and so education from our end really is more to the other providers rather than to the patients, which is ironic, right? Because we dentists think that we know everything, and we don't have to keep learning, but that's exactly the opposite mindset that I find in a lot of the airway community, is that we're constantly on a journey of understanding and trying to figure out what it is that we need to do, right? I mean, some of the people that I've met across the many educational lectures and forums that I've been to in the airway space, they've been on this journey for so many years, and they're addicted to it, and it's so it's so refreshing to see that people who genuinely care of trying to figure out for themselves what makes the most sense. Biggest opportunities, I think. Sorry, can you rephrase what the biggest opportunities in relation to?
And just day to day and growing a practice, where do you see the big opportunities? Growing an airway focused practice.
Yeah. I think for me, having that airway focused mindset is critical. But I think, like all things in life, we have to have a balance too. And I think one of the big opportunities for me is trying to find that balance where our airway health meets aesthetics, meets function. All of those things have to intermingle, and that's I think kind of the balance of those factors for me is pivotal. You can't have too much of one and forsake the others and say, hey, everything is better just because this one column got better. It has to be a give and take, if you will. Obviously, we're not going to move in the opposite direction in any of these columns, but we might not be able to optimize or increase as much as we want to for the sake of the other two things. And I think that's why it's very much an art just as it is a science, because again, every person is individual, and you have to find where that balance is for each person.
It's interesting you say that, because when I started working with Bill Hang in 96,
Mm-hmm.
he wasn't aware that he was affecting the airway.
Mm.
And the proposition was, if we bring the jaws out and forward, upper and lower both,
Mm-hmm.
we're going to create a broad smile that's complete to the corners of the mouth.
Yeah.
And we're going to have a stronger profile, which
Yeah.
was completely an aesthetic pitch.
That's exactly right. Yeah.
And then, and just after the turn of the century, he realized that the basic physics of bringing everything forward is going to open up that tube behind the throat.
Right.
And that's when it really started to take off. But getting back to the biggest challenges, when we're talking to providers every day, their challenge is real. The two big problems from my perspective come down to, the same in almost every office. What they tell me is we want more qualified patients in the lobby,
Mm.
and we want more qualified referrals in the community.
Hmm.
So the opportunity is to educate, which is what I believe, and I'm biased because I spend all of my time in the airway community.
Yeah.
What the airway community does better than anybody else
Absolutely.
is they are just passionate educators and
Yep.
fearless advocates and evangelists for this is a whole health solution.
Absolutely.
So now if I'm coming into an office with myself or my children, I talked to you about Reza. Reza's like, you need double giant. And I know he's true. I just don't want to hear it. And then, we start, and I'm 56.
Right.
So I start doing the math. I'm like, all right, 20 years, 25 years. Do I really need to go through this? And when he lays it out for me of, the question, and there's all kinds of buzzwords now about health span, but what kind of a quality of life do you want to live?
Yeah. Yeah.
At my stage in life as a male, because we tend to be a little obtuse about that, I maybe can neutralize that argument. But now you start to talk about my children, and I go backwards and say, okay, I cannot deny the suffering that I've been through as a result of this. I suffer from chronic pain. I don't sleep well. I snore. My oxygen saturations go down at night. The data's all there. And now we have a solution to prevent that
Right.
with your children, which will put them on a better track. That doesn't solve the nutrition problem. That doesn't solve bad lifestyle. It doesn't
Right.
solve alcohol. Doesn't solve cigarettes. Doesn't solve drugs.
Right.
But it does put a foundation together where if they make good choices, they can have a better life than I've had. That's a tough thing to say no to as a parent. And if I come into contact with a collaborator or a potential collaborator in the community with that proposition, what if we partnered together and we actually can make an argument for why patient outcomes can get better over time? By definition, wouldn't you be interested in that? And who's going to say no?
No, you can't.
That's why I think the airway study clubs are doing so well around
Right.
the country,
Right.
because anybody that's got a couple hours is going to check that out.
Absolutely.
So I think the
Yeah.
biggest challenge in many ways is really the biggest opportunity where nobody knows about this stuff or certainly doesn't understand the true breadth of the solution and what a tremendous impact it can have to pivot a life in an entirely new and better direction.
Yeah.
And once that education's done with the public and in the community, it just creates a whole new paradigm for healthcare.
I 100% agree. I think, you talked about opportunities, the number of people that are affected by, on the spectrum of mild airway disease or to moderate severe, is enormous. I mean, you have admitted that you have some sleep breathing issues. I was a 4Y extraction case. I certainly, have limited tongue space, have bouts of anxiety sometimes and panic issues. And certainly I'm looking to get expansion and treat it for myself. And I think that's why we're so passionate about it, is because a lot of the people that I've met have their own personal story, and that's their journey of trying to figure out for themselves, how do I overcome this? And so that's why I think that's what, Reza included, right? That's why we're also motivated of trying to figure out what's the best answer for us. No, we're not going to care about anyone as much as we do for ourselves and for our own health. And I think when we find that knowledge and we're able to share it with the rest of our patients, we're in a place to do that. And I think that's why it's so such a great community of people that we have in this space.
What do you see in the next 10 years in the best case? Where would you like to lead the industry? How would you like to make your mark? And I don't mean that from an ego perspective. You're not a headstrong guy that way, but if you could get to the front of the pack, where would you take them and why? And I would say for your generation, you are in the front of the pack in my experience, by the way.
I appreciate you saying that. I have a lot of wonderful mentors and colleagues. A couple of people that I went to residency with are very much in the airway space as well. And so I'm in good company, and I'm very proud of the company that I keep, of the people that I surround myself with. I think, my place is going to be in the clinical domain. I want to become excellent, the best at providing, world-class airway-centered orthodontic care, and in whatever modality we can, and truly understanding the most effective thing at each of the different ages and timing of intervention. All of that is still being figured out, right? And then finding other collaborators, other people that can kind of share their journey with me, and finding other people who are just as passionate about providing that care, and then eventually sharing it with the world once we've found some of those things that those pearls that we can share with the rest of the community, and getting that word out there, just as Bill has.
Okay, so you've got 60 seconds with 20 dental students that would take any advice you had to give. What would you say? 60 seconds.
I would say just remember why you got in this in the first place, right? Ultimately, you could have done anything, right? You're in dental school. You're incredibly smart. You're talented. You're gifted. You have a lot to give to the world. But you chose healthcare because you wanted to help your brothers and sisters in this world, your parents, your uncles and aunts, and everyone else. And in order to best serve them and best help them, you have to first educate yourself on how that can be done. And so, the best investment that you can make is in yourself, and spend time truly understanding what you can do to make a difference in the world. And find your niche, right? Find that one thing that you're passionate about, that you don't feel like is work, because then it's not going to be that hard to do.
Last question: what makes you tick? What gets you out of bed in the morning?
I think for me, just hearing from the difference we make in the lives of our patients, I think that brings me the most joy. Hearing about how what we did, it changed their life, right? Changed their life for the better. And obviously I don't have nearly as many stories as Bill does, but he shared a number of them with me, and I'm just I want to get to a point where that can be consistent for everyone who walks in my door, and being able to provide that quality care, individual, care for every single person. That's what keeps me going.
It's interesting because, and I appreciate that answer. I'm going down to shoot testimonials for Reza next week, and we're going to talk to 20 patients or so. And I've been doing that for a long time. And as a storyteller and a craftsman, those are my favorite interviews, because there's so much meat on the bone. And when I say meat on the bone, I mean, what life was like before they got to surgery, the journey that they had to endure to get that procedure done, and the recovery, and then the incredible miracles that occur in their lives after the symptoms have, been alleviated and there's an entirely new lease on life. It's an incredibly epic journey that they take. It's also the most heartbreaking interviews that I do, because I think about, how many millions of people don't have access to this care, number one, don't know it's there, and will never be able to get in that situation to do that. And then how far do we have to go before we stop creating these problems that have to land on the surgical table where, there are 4 of you working over 3 years to get this all done. But the glimmer of hope is, the idealistic nature, the idealism and optimism of your generation specifically, and willingness to live transparent lives, I think is going to help us stem the tide and maybe turn the tide, because prevention, I believe, is going to become embraced, where we've got enough of these stories saying this is really happening and it doesn't have to be this way anymore. And where, we've got a generation of healthcare providers coming up that are tethered to their moral compass and are willing to walk away from, the big and there's nothing wrong with big paychecks, but in trading that out for the best medicine, I have a lot of hope in your generation that there are a lot of you saying, I believe I can have the best of both worlds. And if I have to pick, I'm going to take the road less traveled, because that's where true fulfillment is. And you talked about that is, you all, when my generation suffered through 2008, there was a lot of early teen, instead of teen angst, it was teen, insecurities and taking a look inside saying, hey, I don't want to do that. I'm going to take some steps to not make material gain my sole purpose. I'm going to do something that's got value to humanity that I know is going to be able to sustain me, not just spiritually, but also financially. And I really applaud you guys for that. So thank you. I really, really do.
Yeah, no, I appreciate that, Peter. And thank you for everything you've done too. I mean, it really starts with how, you mentioned before about how you got connected with Bill and how that just stemmed into an opportunity for how many, hundreds of dentists that you've helped kind of share their message and their stories, right? It just kind of snowballs into this massive thing that's unstoppable now. And I'm just super excited for the years to come.